Okay, hello everyone. So today we are going to discuss about the microbiology subject in that immunity topic. So, immunity. You already know that the term immunity means that is exemption or resistance. If you are protected against something, you have immunity to it. Immunity to it. Okay, that is we call immunity. It's nothing but an resistance power of an individual. Okay, so that is what we used to call immunity. That is, it is that protected against something. Okay, that is immunity. Then it is a state of specific resistance to infection. Immunity is an specific resistance to an infection. Okay, the immune system that enables the body to recognize a foreign agent as non-self, which is something other than a personal own substances. That is self than the non-self. Okay, so that is the immune system that enables the body to identify or recognize as a foreign agent as non-self, which is something other than a person's own some substance. The immune system takes a specific action for neutralizing and killing and eliminating that agent from out of the our body or a system. Okay, that is the immune system takes a specific action for neutralizing that foreign substance or any kind of infection or pathogenic organisms. Okay, that killing and eliminating that agent. Okay, so we'll say what it is. What is the exact definition for an immunity? It is the balanced state of multicellular organisms having adequate biological defenses to fight infection, disease, or other unwanted biological invasion, while having adequate tolerance to avoid allergy and autoimmune diseases. We'll see later what is autoimmune disease. It is a balanced state of multicellular organisms having adequate biological defenses, that is the adequate amount of biological defenses or resistance to fight infection or any kind of disease or unwanted biological invasion, okay, while having adequate tolerance to avoid allergy or autoimmune diseases, or the resistance offered by the host toxin molecules, microorganisms, and foreign cells, or else resistance exhibited by the host against any foreign antigen, including the microorganisms. Okay, these are the few immunity definitions. Then we'll move to the types of immunity. So that is, they are broadly classified into two types, that is innate immunity and acquired immunity. Okay, in the innate immunity, we'll discuss these things in detail in the next slides or upcoming slides. That is organs, tissues, and cells of the immune system that you are born with. For example, you know that you have a skin that protects or it resists some agents to enter into your body. Okay, that is that is organs. Innate immunity, that is organs, tissues, and cells of an immune system that you are born with. Okay, whether it may be in skin or any kind of tissues or cells in your immune system. Then coming to the acquired immunity. Okay, here immunity that develops during the your whole lifetime. Okay, that is we used to call as acquired, means we gained immunity. Okay, that is acquired immunity. Innate is by itself with your born. Okay, so here acquired immunity, that is in that again it is classified into subdivisions or two types, that is active acquired immunity and passive acquired immunity. So here active immunity, that is develops in response to an infection or an vaccination. Okay, here the active immunity that develops in response to an infection. Again they have the classifications in that natural active immunity or artificial active immunity. In that natural active immunity, that antibodies develop in response to an infection. So you can see in the slide. So artificial that develop that antibodies develop in response to a vaccination. Here we see in that active immunity that develops responses to an infection or else in a vaccination. Okay, actually, see here the natural and artificial. Artificial is nothing but through the we are getting the antibodies that is developed through the vaccination in response to a vaccination, and the natural due to the infection. Okay, then coming to the second classification, that is passive immunity. Okay, that is passive acquired immunity, that is develops after you receive antibodies from someone or somewhere else. Okay, again here it is classified into two types. Okay, from the natural passive immunity and again artificial passive immunity. Yes, here natural passive immunity, that is antibodies received from the mother. Okay, example through the breastfeeding or breast milk, that is directly from the mother to baby, the immunities or antibodies that is transferred. Okay, here artificial. Okay, so here artificial passive immunity, antibodies received from a medicine. Okay, example from a gamma globulins or any kind of infusions. Okay, these are the main classifications or the types of immunity. Okay, so briefly we will see once again, that is innate immunity and acquired immunity. These are two broad classifications. Okay, in the acquired immunity they have other further classifications, that is active immunity and passive immunity. Okay, active immunity in the sense of response due to or in it develops due to in response to the infection or an vaccination. If it is developed that antibodies or immunity due to the infection, in the sense of it is a natural active immunity, and due to the vaccination it is developed in the sense of it is artificial active immunity. Then coming to the passive immunity, that is develops after you receive antibodies from someone else or somewhere else, that is passive immunity. Here again two classifications, natural passive immunity and artificial passive immunity. Then in the natural passive immunity, here antibodies received from someone else, that is from mother to baby, that is through the breast milk or breastfeeding. And here artificial passive immunity, that is received through from a medicine. Okay, from the gamma globulin injection or any kind of infusion. Okay, then that is again the classifications only we are going to discuss here, that is innate immunity. Innate immunity system is essentially made up of barriers. That's what we seen, that keeps the viruses or bacteria or any foreign particles that out of your body or limit their ability to spread and move through the body. Okay, that is innate immunity, that is we've seen in the example, that is skin. Okay, we are born with our this kind of like organs, tissues, or cells, that is innate immunity. Then the again here influencing factors like age factors or nutritional factors or hormonal influences. Then physical barriers or epithelial surfaces that includes the skin, respiratory tract, intestinal tract, conjunctiva, or genitourinary tract. Okay, these are the physical barriers that prevent the uh, viruses or any organisms to enter into a body. Okay, here that is antibacterial substances, cellular factors. Okay, antibacterial substances like lysosomes and all, and cellular factors, phagocytosis, that itself kills the bacteria or any organisms, chemotaxis, attachment, ingestion, intercellular digestion. Then coming to the acquired immunity, that is second classification, we'll see that briefly. Now we will see that what is acquired immunity, the resistance acquired by an individual during life. Okay, that is immunity or resistance acquired after birth, okay, or during a lifetime of an individual. Here again two classifications mainly, that is active immunity and passive immunity. And active immunity, that is resistance included in an individual after effective contact with an antigen. Okay, here again the two classifications, that is natural and artificial active immunity, we already seen this. Here the natural active immunity, that is acquired by natural subclinical or clinical infections, any kind of clinical or subclinical infections. That is artificial active immunity produced by vaccination, okay, whether it may be TT or tetanus toxoid, BCG and all, you've seen that. Then the passive immunity, that is included in the recipient by transfer of the ready-made antibodies against infective agents or toxins in another host. Here again two classifications, natural and artificial passive immunity. The natural passive immunity through the transplacental maternal antibodies from the mother to fetus or the baby. We are seeing that. Artificial passive immunity, okay, through the antiserum injections or parenteral administration. Then the antigen. So remaining parts we will continue in the next class or a next session.